Hello, everyone. My name is Isabella Lolus, and I am a first year Master of Public Health student here at the University of Florida. My concentration is in population health management, and I'm also an intern here for the Gator Care Wellness team. And today I'm going to be presenting I Spy, Health Misinformation AI presentation by me. So, to start off, a little bit of an introduction. So, the importance of health misinformation is that it influences public perception and health policy decisions. And also, in addition to this, health misinformation essentially is a health literacy gap. It's a result of a health literacy gap and a health literacy failure. And also, the social determinants of health influence the spread of health misinformation. And what are the social determinants of health? It's non-medical conditions that people are born in, live, work in, etc. So this includes socioeconomic status, education, etc. Health literacy, by definition, is the access, reading, understanding medical and public health information, and also applying that knowledge into habitual healthy behaviors. Now, there's a limitation, of course, with health misinformation and a need to have more educated decisions to improve health literacy, and also media literacy, and implement more effective interventions to tackle the spread of health misinformation and more. Now, with AI, which stands for artificial intelligence, this is found from diagnostic to treatment delivery and patient management. So, technologies like telemedicine, chatbots, etc., enhance accessibility and break down some health literacy behaviors. Of course, this was very prevalent during the pandemic, COVID-19. And AI also has the potential to mitigate health disparities and ethics around data usage and HIPAA. So essentially, it's a multifaceted tool with high accuracy that can save time on operations and computation procedures, and can also take on a support role for human healthcare workers. So essentially, taking on the hard skills of human workers, and which allows human workers to focus on their soft skills and build on patient relationships and team building. So, and these soft skills include, of course, like active listening, empathy, etc. So here are our objectives. So this presentation serves to differentiate and identify health misinformation and health disinformation. However, there's going to be an emphasis on health misinformation. Improve your intellectual wellness about the integration of certain technologies in the healthcare industry, and also inspire you to do your own research about these topics and their uses in the healthcare industry. So overall, I'm here to just educate about health misinformation and AI uses, including pros, cons, in healthcare now and in the future. Now, disclaimer, some of the topics, so for example, the health misinformation section of this presentation has some political intertwining with it, essentially. So again, I'm here just to educate, not to take any political stance or politics, etc. But of course, public health and politics go hand in hand, unfortunately. And also with AI, there will be some ethics and moral concerns discussed. But again, education is your best tool. I'm here to educate, and I encourage everyone to go and do their own research on these topics as well. So, introduction, some more background info. So, there are debates and continuous changes within health. So, in Florida, there has been the suppression of reliable information and deliberate bias interpretations of data. So, essentially, in Florida, there's a big debate between political science, which is politics that influence public health outcomes, versus the scientific method, which I'm sure we've all learned about, which is essentially unbiased raw data influencing these public health interventions. And in the US, continuing on, there's confusion versus collaboration about the roles of public health officials and individual rights to maintain or improve public health. Now, public health officials are meant to safeguard the health of entire populations, but again, the political environment in the US creates confusion on how much these officials, their power, how much power they have over individual people that can then influence their own state of health. And of course, non-scientific communication influences all of this. And this kind of communication includes like ads, political speeches, even conversations you have with your coworkers. So they play an active role in communicating health info, again, to non-scientific audiences. Now, globally, focusing more on AI may help in health communication by efficiently and quickly assessing and communicating risk of new disease and its prevalence in communities, impact infodemic management, and also promote inclusivity and a cross-sector collaboration. Now, what is infodemic management? Management, essentially, infodemic means too much false or misleading information being spread into digital and real life spaces, especially during disease outbreaks, which essentially this leads to confusion, unhealthy risk-taking behaviors, and also mistrust in health authorities. And in addition to this, infodemic management also has ties with AI. So AI can actually help debunk this online misinformation and promote community engagement with healthcare advice, with expert advice. Essentially, the data you feed the AI is what you're going to get out of it. Now, cross-sector collaboration involves partnerships among various companies. So this includes tech companies, academia, government, etc., to improve patient outcomes and quickly create high-quality real-world interventions. Inclusivity means including people of all races, ethnicities, ages, sexualities, etc. So health misinformation. First section. Misinformation, the definition is that it's information that is incorrect or misleading, not according to the consensus of credentialed scientists reviewed, a peer-reviewed empirical evidence. So this misinformation is often spread on the internet through social media sites and or politically charged news stations or groups. Now, disinformation is misleading information spread with an intent. This intent can be political, reputational, financial, etc. It's essentially part of a bigger picture that warps a believable core with layers of false information. So it's a lot more harmful to individuals and society as a whole. And this affects the credibility of scientific experts. So again, health misinformation is not intentionally false, but the disinformation usually is. Now, the correlation between the two, as of now, it's unclear why do they spread, who exactly spreads, and what is the intent. The intent can vary depending on the situation. However, we do know that both threat decisions regarding public health, the environment, and national security, and this also affects health promotion and disease control. Now, looking at these examples, we're going to talk about why are these sources misinformation, health misinformation. Now, if we look at the first on the left, which is Source Children's Health Defense 2024, we can see that there's these little excerpts, and essentially it's about vaccine effectiveness. So the first one you can see, vaccine manufacturers have no product liability, and the government has paid over $5 billion for vaccine injuries. Another one, some vaccines like COVID-19 shots for children may cause more injuries and deaths than the disease themselves. Now, if you look into the website itself, Children's Health Defense is proven to be an anti-vaccination nonprofit organization that promotes these conspiracy theories. But looking at these actual excerpts, even if you didn't know anything about the website, there's no in-text citations, there's no references anywhere, so you can't even see where this information is coming from. There's no specific organization stated, like the APA, American Public Health Association, or the CDC, or the NIH, etc. There's also very startling numbers and words, bold words to get your attention and to evoke some kind of negative emotion. This all indicates health misinformation. Now, looking at the next example where you see Humble 2011, this excerpt is from a book called The Miracle Mineral Solution by Jim Humble. Now, just to give you some background information, Jim Humble had no medical credentialing, and he was also a former member of the Church of Scientology. Now, looking at the excerpt right here, for example, you can see right here, This miracle mineral supplement works in a few hours. It's the number one killer of mankind in the world today is malaria, a disease that is usually overcome by this supplement in only 4 hours in most cases. And then it says, of course, after taking the supplement, even AIDS patients are often disease free in 3 days, and other diseases and conditions simply disappear. Now, all these outrageous statements like, oh my God, this is a miracle cure, whatever, like that, that indicates health misinformation. And again, there's no reliable sources being cited, there's no reputable organizations, again, being cited, and it's just outrageous statements saying, oh, this will cure you of things. Just not true. Now, continuing on. So, just some fun facts. Up to 40% of posts on social media contain health misinformation regarding the vaccines, treatments, chronic diseases, etc. And also, almost 72% of people use the internet first when they need health related information. We are in a digital age after all. So, reliable health information is information that is accepted according to the consensus, again, of credentialed scientists reviewed, of peer reviewed empirical evidence. So, this is a little checklist you can do for a source to determine if it's credible or reliable, which is their synonyms. So a website ending .gov, .edu, .org. As of now, your best bet is going to be .org, nonprofit organizations that give you unbiased explanations of what's going on. .gov will reflect the current administration's thoughts, values, policies, etc. So this fluctuates. So again, you have to look at the .gov websites with a grain of salt. And also .edu, kind of the same thing, but it's a little bit more stable than .gov. References, again, referring to like databases, and this includes like Oxford academic journals, PubMed, Frontiers, etc. Those are all really high quality medical databases, health databases. Quality of the About Us or Contact Us section. So again, the author's background, whoever wrote the article or the created the website. Ideally, you want to have some kind of health background, medical background, etc. Dates, keep it pretty relevant. You want to read something that's within like 5 to 6 years of publication, maybe no older than a decade. And again, common sense and a grain of salt. So, general questions to ask yourself: who's the author? What are their credentials? What is the purpose of the content? Where's the content coming from? Dates. How does this make me feel? And then you want to think before you share. And also, just to note, some people will cite from reputable sources, but they still will say misleading information. So, it's important to go back to the original source and read it for yourself. Or again, they can also draw correlation or causation when the publishers of the research did not explicitly state or can even like extrapolate results. So an extrapolation example is like predicting a company's future sales by assuming the current sales trend of increasing by a fixed amount each month will continue. And here are some great examples that you can follow. So some more examples. Health information. So if you look at the first one, Sensa, some background info. Sensa was a powder-based diet aid invented by neurologist Dr. Alan Hirsch, and it was designed to enhance food smell and taste to make users feel full faster, which would lead to weight loss. So essentially, no diet or exercise was needed. But there was a lack of scientific evidence for this. And again, this is kind of like that unbelievable claim, quick fixes, miracle cures, which do not exist. That all leads essentially equates to health misinformation. Now, if you look at the example to the right here, this is from medlineplus.gov. And just by reading it, you can see it's broken down into several sections. So this all has to do with weight management, weight loss, etc. So medicine. So if making lifestyle changes or doing weight loss program are not enough, then maybe your provider will prescribe medicine. Then how can I maintain my weight loss? And you can see there's also hyperlinks to outside resources. And here, by the NIH. Then it gives you a start here. NIH, diagnosis and tests about BMI, obesity screening, again, NIH. treatments and therapies. So it's a lot more organized. There's no like outrageous words to evoke emotion in you. Just telling you clear, concrete facts and also has a reputable source included, which is the NIH. So some methods to identify misinformation. One is to fact check and also the author background and agenda and the type of studies that are included. So ideally, we'll talk about this a little later. We want to have systematic reviews and meta-analysis. Those are the best kinds of studies. Method two, if whatever is being talked about looks, if the treatment or the product, whatever, if it looks good to be true, looks too good to be true or is outrageous sounding, then it's probably not good information. And three is kind of like interpersonal, so you can ask others around you in the workplace, ideally who have some kind of medical or health background credentialed as well. Now, factcheck.org is actually a great website to use because it is a nonpartisan, nonprofit organization project of the Annenberg Public Policy Center of the University of Pennsylvania. So you can type in any kind of website, it'll debunk things very non-biased, clear view. So some signs to watch out for, fear-induced headlines. Again, number one ingredient is killing you. Oh my God, you have to do this thing to cure this. Unbelievable claims, or if like the medical community is hiding something, no credible sources listed, and also the promotion of products via like a checkout link or coupons, which was found in the Sensa example earlier. And now here, this is from again the Children's Health Defense. And you can see here the author of this article, she was essentially saying that people vaccinated with the COVID-19 boosters in 2023, 2024 were more likely to get COVID-19 than their unvaccinated counterparts, according to a study published last week in the Annals of Internal Medicine. Now, she explained a little bit about this study, and I highlighted the important parts here. So here, the researchers found that the vaccine efficacy against COVID-19 infection was negative 3.26, indicating a statistically significant higher infection rate in vaccinated compared to unvaccinated control group. Now, first of all, if I'm reading this, I'm like, I'm going to go into that study and read it myself. So, or again, you can use AI to kind of help break down the study and to put it into more simple terms. And you can see her background here too, is in capitalism and politics and human geography. So there's no actual, where's the medical credentialing, public health, nothing like that. So, so this is the research that she cited. And now this is a reputable source and the database is reputable, credible, etc. But if you actually read into it, essentially the big part that she highlighted was that randomized controlled trials, which are like the golden standard, demonstrating the efficacy of the XBB COVID-19 vaccines have not been done. So essentially she's saying that, oh, they're they're not effective then. But if you actually look into the study, the mean age of the sample, so the sample was 91.3% male, and the mean age was 69.9 years. And these were also only men in the U.S. Veterans Health Administration system. So the results may not even be generalizable to the broader population due to, again, differences in age, sex, and underlying health conditions. And also, essentially, this falls into the false dilemmacy fallacy. So people sometimes assume that if one explanation or claim is false, then the opposite must be true. But in reality, both could be false, or the truth could be something else entirely. So in this case, unvaccinated does not mean more likely not to get infected. And these are just some things you can consider when looking at any kind of study. So the accuracy, reliability is the most important to look at, and the validity. So study designs and types, again, your best for low risk of bias and high quality of evidence is systematic reviews and meta-analysis. And then here are RCTs. Now, why does misinformation spread? So, personal agenda, this can include, again, financial gain, political advantage, publicity, etc., or just the uncertainty or absence of easily accessible and credible information. So people essentially want to fill in the gaps with whatever they can, and this can be just completely untrue information, again, the misinformation part. There is also something called the deficit hypothesis and or other limited literacy types. So what this means is that people who believe misinformation do not have sufficient knowledge or literacy to discriminate between true and false information. So this obviously poses problems over time. There's also emotional tone. Again, as I mentioned earlier, stronger emotions evoked like anger or fear or even sadness, there's more impact and you're going to remember whatever you're reading more. Also, there's limited, again, health literacy, digital literacy, etc. Personal experiences or relatability. So this is, again, the socioeconomic status factors included. Variety of accessible platforms on social media, even news stations, etc. And there's also built-in product features and algorithms like on TikTok, Instagram, etc. One thing you look at, if you look at it for a while, the algorithm will show you more of it. And statistics, again, with politics concerned, there's gaps in specificity and impact. So like the floridahealth.gov. And here are just some ways to combat misinformation spreads. We have educational courses, inoculation games, and also counter speech. So you can kind of see what I highlighted here, the main points of each one. So, repercussions of health misinformation, effects on compliance with health recommendations, detrimental effects on attitudes and intentions to uptake a health behavior, and also the implied truth effect, which is a psychological phenomenon which people judge false or misleading information to be more accurate because it has not been flagged with a warning label. Now here, this is the Bronfenbrenner's ecological system theory, and this is essentially just characterizing infodemic management strategies, which influences, again, health behaviors and outcomes. So essentially, this is the individual level all the way to the institutional slash public policy level. You can see with the health misinformation spread, you first want to track, debunk false information, then focus on the literacy, interpersonal, etc. Now, the main takeaways. Health misinformation can be spread anywhere and by anyone, so check the credibility of your sources. Make sure it's supported by peer-reviewed empirical evidence. Understand the basics of study designs will help you identify health MI faster. And also, you could spread the use of reliable websites like Mayo Clinic to family, friends, coworkers, etc. for updated health. Also, to mention, some .com websites are okay, such as webmd.com. But again, you have to look at, is it selling me something? What's the tone? Are there any, again, the in-text citations like references, credible sources included? And also, just a general note, the CDC in the last few years has wiped certain data sets of certain populations. So again, government and public policy, public health, it's changing and it depends on what the current administration, what are their beliefs and what are their values, etc. So, all right, now we're on the history of AI in healthcare. So, just some background, AI or artificial intelligence actually the talk started around in the 1950s. And this was with the Turing test, which was discussed in the Summer Dartmouth conference on AI. You can see right here the Turing test essentially, so there's a human interrogator asking several questions to both players. There's a computer and a human responder. Now, based on the answers, the interrogator attempts to determine who's the computer and who's the human. It's actually really hard. So the computer is pretty human-like. Some other examples. So the first robotic arm was by General Motors to help, again, carry heavier things, machinery, etc. 1964 was the world's first chatterbot. And this chatterbot was called Eliza. It was created at MIT for psychotherapy. And nowadays we have like Navigator at UF Health that kind of helps with everything to do with public health at UF. And the 1970s, we have the world's first artificial medical consultant. The 2000s, we have the IBM Watson question answering system. Then, of course, with the COVID-19 pandemic and acceleration with telemedicine usage, AI chatbots, and this is like included on websites. Again, there's some like on the CDC, Mayo Clinic, etc. Areas in healthcare where AI is now being integrated, precision medicine, public health information, immunization, medical education, and telemedicine again. So deepfakes are synthetic performances by AI to exchange faces and images and modify voices. So to think of it, AI is an umbrella term, and under this you have things like, again, the advanced machine learning, which is a deepfake, and they learn from large amounts of data how to alter and produce content. AI, again, is a subfield of computer science, tech related to data processing, text generation, problem solving, etc. And the correlation to healthcare is to protect real data of patients and also just research work. And of course, again, the additional resource optimization and task automation, or essentially in healthcare delivery systems, the management of everything that takes place. Here are just some examples of how it's used in healthcare. So, big variety. And these are specific AI applications. So you may be familiar with some. Maybe I encourage everyone to look more into these. Now, here we're going to look at some of the pros and cons of AI integration in healthcare. So pros include right now, there's not that much technical expertise required to use AI and also the equipment for deepfakes. There's also increased access to information, including misinformation, more attractive marketing, greater visibility and trust, and there's also a diagnostic and resource improved management. You can see right here, some of these risks and benefits are also talked about. Now, in this example, this was a study about the intersection of deepfake and AI. So, nursing students were shown a video of deepfake in an ad with deceased celebrities, a news item stating legal risks of deepfakes, and a news item about Microsoft tech that uses deepfakes for relatives of deceased people to talk to them via chatbot. These were all hypothetical, made up scenarios. But essentially, the nursing students, this was the overall risks, benefits to how the AI was integrated in these three ways, and then the conclusion right here. So the cons, susceptibility again to misinformation, the truthfulness, there's doubt to that, identity theft, malignant impersonation, reputation damage, and then of course ethical concern, because there is no regulation regarding this technology right now. There's not that much out there. And here's just the transformation matrix of deepfakes, kind of how it works. It's very complicated, but again, I encourage everyone to look into it, kind of see, maybe play around with the technology yourself. So the history of AI in healthcare going into the future, CNNS, which you can see right here is the convolutional neural networks, can use disease symptomology in clinical imaging for clinical diagnosis. And this is for a whole bunch of areas, so dermatology, oncology, chronic pain, etc. So CAD is computer aided designs for radiological image interpretation, skin pathology, genetic engineering, triaging, diagnostics, etc. And there's just many more to come. So right now the possibilities are limitless. And actually, before I forget, there is an emerging machine learning, which again is under the AI umbrella, called blockchain. And this is a ledger system to store and manage patient data, supply chain management, and clinical data securely. So it's encrypting records and also has integration of medical devices to treatment plans to share data faster with patients and the providers. So this ranges from like health insurance to referrals to even appointments. Now, here are just some examples of the CDC using AI. So you can see surveillance program, flu site. So using AI and ML, which is machine learning, to predict influenza or the flu. activity in the US. And here's the impact. So you can see this AI, the chatbot that they have, contributes to over $3.7 million estimated in labor costs saved to date and a 527% return on investment. And this is just UF Health statement on artificial intelligence. So you can see they're combining world-class research infrastructure and leading-edge research, transformational approach to the curriculum, College of Medicine. They're developing AI-enabled systems, etc. You can read the rest here. Now, how do you detect AI? So first method, kind of like the health misinformation detection, fact check using reputable sources. So right now, a reputable source can be Grammarly, and Grammarly has a built-in AI detection software. Also, just if it's text-based, if there's very vague or very broad language repeating like a prompt with overused words or like figurative language, including similes, metaphors, onomatopoeia, things like that, that can be indicative of AI. Method two, if it looks too good to be true, or if it's again outrageous looking or sounding. So with pictures or videos, if there's unusual lighting, like weird camera angles, body proportions, robotic speech, artificial movements, etc., that can be indicative of AI. I mentioned this example right here. So, oops. If we look at this right here, Sora 2 AI, it's not opening up right now. Oh, there we go. So Sora 2 is essentially a invite-only AI software. It's video and audio generated models. It's highly realistic. And I think this version was, yeah, it was released September 30th, so not that long ago. And OpenAI so owns this and ChatGPT, which is probably more familiar. This is highly, highly realistic. I mean, again, this you have to be careful with what you see because it might be, oh my God, it looks true, but it's not. So, like a quick example right here.
Today, we're announcing the Sora app, powered by the all-new Sora 2.
I don't think you can hear it, but like all of this.
That's at the bill for more details.
The art for motion, physics
too.
IQ, and
All
body
AI,
mechanics,
not
marking
real.
a giant.
Not real. Anyway, this is very real.
Letting your friends cast you in.
So, especially with this technology, you have to be a little bit careful. And again, third method, you can ask trusted individuals around you or those in relevant fields like computer science. Potential effects, so there's creative freedom with all this, but there's also harm to the viewers, subjects, society itself, truth decay, and also social polarization. So truth decay is just essentially you can't differentiate with what's real and what's AI generated. And then social polarization is the segregation of society into different groups based on opposing views or like social divisions, and this may turn hostile. And then, of course, there's privacy violations and security threats. So here, ChatGPT prompts. I essentially typed in, tell me a story about a girl with a certain condition, but she had a happy ending, something like that. So here, like, when she was 13, she was diagnosed with lupus, blah, blah, blah. At first, she tried to ignore it, pushing herself to keep up with her old life. Sounds very dramatic, very like, oh, evoking emotions in you. So here, she found comfort in painting using bold colors to express what words couldn't. And then at the end, right here, she hadn't just survived, she had transformed. If it sounds emotional like that, again, indicative of AI can be. Now this I used perchance AI and I just typed in girl in hospital bed. So this girl's not real. This is AI generated, and you can tell because if you look at her shirt right here, she has a sleeve and then over here, there's a spaghetti strap. So it's kind of off. It doesn't look right. Now, utilizing AI, you can summarize major health events, so public health news, or again, studies that are maybe you don't understand just reading it yourself. Also, health advice can give you good health advice, so general nutrition, exercise, nutrition label components, etc. But of course, you want to make sure that information is backed by reputable sources, and if in doubt, ask your primary care physician or closest medical professional. And AI is only as good as the data you feed it or whoever feeds the data. So SMART goals. So SMART goals are essentially specific, measurable, achievable, relevant, and time-bound goals. So it's a framework for setting and completing goals, and this can be on any kind of topic and anything. Exercise, nutrition, learning something for the first time or becoming proficient at something. So there's media production, again, data or time management within a company. Possibilities are endless, as I mentioned earlier. So just remember that AI is a collaborative tool. It's not a total replacement for human workers because AI cannot replace human emotions or adaptability. And these are the soft skills that, again, AI can take over the hard skills part, but soft skills will always be human at heart. This includes, again, stress management, teamwork, empathy, active listening, etc. So the possibilities and challenges, to sum up, possibilities, you have an instant second opinion, and this also allows health professionals to connect more with patients and not have to worry again about the hard skills part or just data, looking at data, interpreting data. There's also faster mass communication and management of large amounts of data, and also has the potential to reduce health disparities, of course, with inclusive data and minimal bias. And how can it do this? Well, it can identify at-risk populations like BIPOC, LGBTQ+, and also design personalized interventions and improve diagnostic accuracy. Now, the challenge is there's no extensive programming expertise, so this pretty much is accessible to people with technology like a phone, computer, etc. It's also limited laws regarding AI and deepfake usage in industries outside of healthcare, pretty much any and every industry. Also, credibility, trust, and perceptions may be warped. And like Spider-Man said, with great power comes great responsibility. So, main takeaways. AI is accessible to anyone with tech and is becoming a large part of society in the coming decades. Deepfake technology is mostly unregulated, so be skeptical of what you see online. And just see how AI can improve the quantitative or like hard skill functions so you can spend more time on soft skills, which is key to team bonding, company morale, and also just improving the healthcare system itself and health services, delivery of health services. And this is just a mind map illustrating everything to do. This is more so with deepfake technology in healthcare. So it goes from patient care, medical training, communication, imaging, etc. So pretty much limitless. And here are my references. So, oops. All right, and that's all. So thank you so much for watching. This will be, I believe, will be uploaded on the Gator Care Wellness YouTube. And I will try to put the references and any other external websites I believe are important to this presentation in the description. And yeah, I appreciate your time watching this presentation. Have a great day.